Senator Gerba. Thank you. Thank you, Madam Speaker. Honorable colleagues, I rise today in support of S-243, the Act respecting the National Framework on Women's Health in Canada. I commend Senator Henkel for this initiative. I commend her also for the thoroughness of her work, as well as all the senators who have contributed to our deliberations on this vital issue. Senator Ravalia just spoke, and I thank her. This is a vital matter. I have already told you my personal experiences with the healthcare system. I won't tell you the same story tonight, but my experiences are one of the reasons why I agreed to speak on this topic tonight. Women's health cannot be relegated to the background. Women's health is at the heart of public health. It directly reflects the quality and equity of our system. Despite progress, systemic shortcomings persist, such as symptoms that go unrecognized, which my colleague spoke about, delayed diagnoses, and inappropriate treatments. These failures are not isolated mistakes. Rather, they stem from a model that does not sufficiently incorporate the biological, social, and cultural specificities of women. S-243 addresses this by proposing a coherent national framework centered on 4 action verbs, all of which I like. These are understand, it's important to understand, important, and also to prevent. We must prevent rather than heal after the fact, and train and coordinate. Coordination is, of course, important too. The aim of this bill is clear. We want to move from a system that corrects after the fact to one that anticipates, that takes differences into account, and ensures equitable quality of care across the whole country. However, it is important to recall the difference between equality and equity. Equality standardizes, equity adapts the response to meet real needs. Not all women present with the same symptoms. Not all women face the same risks or live in the same circumstances. Their situations are different. So, we can't treat everyone the same exact way.
Is to adjust our policies, practices, and tools to ensure that the quality and the safety of care are guaranteed for every woman.
Honorable colleagues, childbirth is not a perfect experience. There is a lot that goes on. Childbirth is medical, but also psychological and social. Too often, childbirth is treated as a routine event, whereas behind every birth, there is a unique story. All moments can tell the story. Pregnancy is just one step, and childbirth is another step. But there can be so many complications. There can also be postpartum depression, which we don't discuss a lot. So, we truly do need a national framework. A national framework will give medical teams the tools that they need and will ensure that women receive the care and support that they need. In this unequal landscape, there is yet another reality which is under-acknowledged. Black misogyny. That is a specific form of discrimination which combines both racism and sexism. It specifically affects Black women. I am sure that not many of you have heard of this. However, this phenomenon is well documented in Canada. Radio-Canada covered this phenomenon. Misogynoir, or Black misogyny, manifests itself in stereotypes that fuel discriminatory mechanisms with tangible consequences for health. Indeed, health professionals listen less to Black women's suffering and symptoms because they believe that Black women are more likely to experience or report pain. As a consequence, examinations are less thorough and, of course, trust is eroded. This reality takes on a tragic dimension when we think of the late Soki Siayogosola. She was the mother of my assistant, Magali, who you know. She was a Black immigrant woman who died in Montreal in 2008 from internal bleeding following a miscarriage. Despite test results indicating a serious risk, the doctor on duty did not believe the findings and did not do anything to help her. Can you believe that? This death, which received widespread media coverage at the time, painfully illustrates what specialists describe as the medical manifestation of Black misogyny. It is a structural tendency to downplay the pain, symptoms, and credibility of Black women, leading to potentially fatal consequences. Giving
that a national framework for women's health must explicitly address these biases. Cette violence systémique ne touche pas uniquement.
This systemic violence does not affect Black women only. Indigenous women also experience it, as we tragically saw with the case of Joyce Echaquan. Joyce was an Atikamekw mother who died at the Joliet Hospital in 2020 after live streaming racist insults from staff. That is our healthcare system. Her case revealed the persistence of discriminatory and dehumanizing practices that directly endanger the lives of Indigenous women. Dear colleagues, the state has a duty to guarantee a healthcare system that is fair, inclusive, and truly responsive to women's needs. Investing in women's health is not a series of isolated measures. It is about strengthening the very foundations of our system. It is about supporting families, fostering social participation, and promoting prosperity. That is essential. By acknowledging these weaknesses in the system, be they inequities in diagnosis, flaws in the perinatal continuum, social pressures that render distress invisible, or the specific barriers faced by Black and Indigenous women. By acknowledging all of this, we affirm our commitment to taking sustainable and systemic action. This is how we will build a truly equitable healthcare system that meets the realities and the needs of all women.
Bill S-243 is essential because it ensures that every woman, regardless of her background, identity, or where she lives, has access to care based on science, empathy, dignity, and equity. For all those reasons, I fully support this legislative initiative. By passing S-243, we can finally translate repeated observation into measurable results for women, their families, and their communities, and ensure that best practice become norms across our country. Je vous invite donc, chers collègues,
I therefore urge you, colleagues, to refer this bill, Bill S-243, to committee for consideration as soon as possible for an in-depth consideration and for us to finally create a national framework for all women. Thank you very much.